Hi, my name is Anissa Hyder from UT Southwestern, and you're watching Let's Talk About It. Joining me on this episode is our Adolescent Medicine Fellow, Dr. Julia Durante, and we're here to talk about equity and empowerment in HPV vaccination, while also clearing up some misconceptions about HPV and getting the vaccine, including age, sex, race, and more.
Hello, my name is Dr. Julia Durante, and I'm a fellow in adolescent medicine. I completed my pediatric residency at Lehigh Valley Hospital in Pennsylvania, and I'm currently a third-year fellow in adolescent medicine at the University of Texas Southwestern. I've worked on a number of research projects, including those on HPV vaccination in young people, and I'm excited to talk about this today.
Thank you, Dr. Durante. So, to jump right in, there's a lot of misinformation about the HPV vaccine in general. But can you clarify who exactly should be getting this vaccine?
Sure. I think a lot of this misconception comes from misunderstandings about what HPV is and who's at risk. The truth is, 80 to 90% of men and women will be exposed to HPV during their lives. HPV is the most common sexually transmitted infection, and it is in fact so common that, like I said, nearly everyone will be exposed during their lives. About 80 million new infections are currently active in Americans, including 14 million new ones each year. Many people will be able to fight off the virus, but in other cases, the virus can then cause changes to the cells that it's encountered and lead to cancers. Um, Almost everyone can be infected, so it's better to prevent it than to try and just deal with cancers when they come, because even though we've had many advances in cancer treatment, it would be much better to prevent these cancers than to let them happen. So who should get the HPV vaccine? Everyone should get it. The ideal time to get it would be between the ages of 9 and 15, because at that stage, your immune system actually only needs 2 doses of the vaccine to have adequate protection from these HPV-caused cancers for life. After the age of 15 up to age 26 is also a great time to get it, because that is still, again, before the age a lot of people are exposed to HPV, and it's before the time that most people are going to be developing these cancers. Now, between 15 and 26, you need 3 doses. What about beyond age 26? Because many people were already teenagers or young adults when this vaccine came out, when it came out in the mid 2000s, in 2007, 2008. Many people were already teenagers or young adults, and they weren't sure, would it be appropriate for a young adult? And the answer is yes. Young adults over the age of 26 and adults really should still consider getting this vaccine, especially if they never started the series at all. It's something that protects against multiple strains of cancer-causing HPV. That means that even if you've encountered some HPV, you may not have encountered every strain that could cause you cancer. And they've actually done research that showed people who got vaccinated later, even at ages 17 to 30, have a lower HPV cancer risk than those who never got a vaccine. Now, the lowest risk is among those who get vaccinated before the age of 17, which is an age most people have not encountered HPV through sexual activity yet. But even getting vaccinated in young adulthood can provide protection.
There's also the misconception that the HPV vaccine is a female vaccine to protect women and girls. Can you talk a little bit about the types of cancers that boys and men can get from contracting HPV?
The HPV vaccine was originally built as a cancer preventing vaccine for one main type of cancer, cervical cancer in females. That is because of the types of cancer HPV causes. Cervical cancer causes the most deaths. The first iteration of the vaccine prevented against 70% of those strains that cause cervical cancer, whereas the current strains are now prevented against 90% of those cancer-causing strains. But that being said, the number of cases per year in males of oropharyngeal cancers, which means cancers of the mouth, throat, and inner throat, and the area in the pharynx and behind the throat, that is actually a higher number than the annual rate of cervical cancers. Now, it doesn't get as much attention because people associate this with female types of cancer, cancers of the cervix and also cancers of the vulva or the vagina. But it causes cancers in males as well. The second most common type of cancers that males will contract from HPV is anal cancers, cancers inside the rectum, as well as cancers of the penis. And these can be more stigmatizing and difficult to talk about because the primary way a male would get an anal cancer would be through receiving anal sex, which is still something we as a society are really reticent to talk about. And it's still something that a lot of people are not really comfortable disclosing about themselves. So for that reason, the cervical cancer prevention still tends to be more prominent in public health campaigns. But the truth is, men get these types of cancers too. We're just not talking about it.
So, in speaking of contracting HPV and developing related cancers across the sexes, how is HPV transmitted? And is there any way to avoid getting HPV aside from getting the vaccine?
HPV is transmitted in a few different ways. One is skin-to-skin contact with infected skin. Another is exchange of body fluids of someone who is infected with the HPV virus, because those body fluids can contain viral particles. But HPV is sufficient to be spread just through skin-to-skin contact. What this means is, for non-genital strains of HPV, you can get a wart by shaking hands with someone with a wart. And when that comes to genital warts and HPV-caused cancers, that means that even if you are using a condom to prevent body fluid transmission, the contact of skin, and that means skin of the mouth, skin of the private areas, all of that can be sufficient to transmit HPV virus from one individual to another. So condom use is not sufficient to prevent HPV. And one thing I hear from parents sometimes is, if my kids won't be at risk for this if they use a condom. Well, that's not exactly the case. There's some STDs that are not as easily spread that you can't contract just from skin contact. HIV, for instance, you cannot contract just from skin contact between two people. But HPV, that is sufficient. So the condom use is not a sufficient strategy to protect the population from HPV.
Wow, that's incredible. So, Dr. Durante, what about any racial or ethnic disparities when it comes to this virus and vaccination rates?
There's some interesting disparities in the way the HPV vaccine is distributed and the way HPV-caused cancers come up. So the interesting thing is, Hispanic youth and Black youth actually have higher rates of starting the vaccine series, but they have lower rates of finishing it. So the Hispanic youth and Black youth are less likely to finish the vaccine series than white youth. Another reason that disparity is particularly important is Black people, especially Black women in the US, have the highest rates of HPV-caused cancers, and they have higher death rates from HPV cancers in the oropharynx, in the cervix. So that has to do with multi-level different contributors to disparities. America has a very a big problem with access to healthcare and access to high quality healthcare. And there's places where, based on your geography, your income, there's many different contributors, reasons why those death rates can be higher. Screening access has something to do with it as well, because like we said, cervical cancer particularly can be screened for. But if you're not going to regular doctor's checkups, if you don't have access to that kind of care, then you might not have a cancer detected early enough to treat it.
So, as a final question to you, Dr. Durante, what do you say to parents who are hesitant about getting their child the vaccine when they come into your office?
I think it's important that we talk about HPV just like it's a routine vaccine that's going to prevent a serious illness, cancer. And it's just as important to get as all your other vaccines. Ideally, when I talk about the vaccine your child is due for, I talk about, and you're due for the HPV vaccine, because in my view, that is a routine vaccine that everyone should be provided. It's not a special vaccine you should just use if you really think you're at risk, because everyone's at risk. Now, the sad thing is, in many states, including Texas, and that, in fact, across the country, people have lower rates of HPV vaccination in their kids than they do what we call like the required childhood vaccines that you need to go to school, like tetanus, diphtheria, pertussis, or meningitis. We actually have about 90% nationwide coverage on those vaccines, but only about half of teens start the vaccine series for HPV and fewer finish it. In certain states like Texas, that rate is even lower. Only about a third of Texas kids have gotten at least the one shot at the HPV vaccine. That is multifactorial, and I think has to do with some bad publicity that happened around the time the vaccine came out. There was a really big, I think people were trying to decide what we should do with this new, very important vaccine. And some people were thinking, maybe we should make everyone get it. Other people were saying this vaccine is dangerous because it suggests kids should have sex because it's without risks. And I think neither of those are really a sufficient explanation. I caution all parents that vaccinating against HPV does not encourage sexual behavior. And talking to kids about safe sex does not encourage sexual behavior. In fact, a lot of parents are relieved to know parent and child conversations about sexual morals, values, safe sex, making smart decisions when it comes to your body and sex. These are actually associated with delaying the age that teens start having sex and increasing the likelihood that that teen is going to use a condom. Some parents are afraid if they begin talking about this at home, they'll tell their teen that it's okay to do it. But it's actually the opposite. If you start talking about this at home, you provide a safe space that your teen can ask questions about when they're exposed to things through their peers, through the media, through romantic partners, and they have the ability to have a parent they know they can talk to about sex. So it can be a very embarrassing and scary conversation to start. But I encourage parents, if you're worried about this probably means that we need to improve communication on this instead of backing away from it. So I recommend the HPV vaccine for everyone, male and female, preteens, teens, young adults, anyone who's not yet gotten it. If you're not sure if you've had the vaccine, you should check your vaccine records. You can ask a pediatrician if you were given it, because many doctors are presenting it like it's an optional thing you should opt into instead of a regular vaccine that really all youth would benefit from. So I recommend, even if you're a young adult and you're not sure if you ever got the vaccine, to look into it and see if you can get it. Thank you for watching this episode of Let's Talk About It, where we talked about HPV equity and empowerment and just how to empower yourself to make the best decision for yourself and for your kids to decide whether getting the HPV vaccine is right for you. Thank you.